Welcome to my channel. Subscribe now. Witty 2 inventions. Foods to eat for a healthy kidney. Witty 2 inventions. A kidney infection, also known as pyelonephritis, is a type of urinary tract infection, UTI, that occurs when bacteria travels from the bladder to one or both kidneys. It is a serious infection that can cause pain and other health problems if left untreated. Causes. A kidney infection usually happens when bacteria, often a type called E. coli, gets into the urethra, the tube which carries urine out of the body, and travels up through the bladder and into the kidneys. Ascending infection. Most kidney infections start as UTIs in the bladder and travel up the ureters, tubes connecting the bladder to the kidneys. Bacteria from the bloodstream. In rare cases, bacteria can enter the bloodstream and travel to the kidneys, causing an infection. Underlying conditions. Certain conditions like kidney stones, structural problems in the urinary tract, or a weakened immune system can increase the risk of kidney infections. Symptoms. Fever and chills. These are common symptoms of a kidney infection. Back pain or side pain. The pain may be localized to the area near the kidneys or radiate to the groin. Painful urination. Burning or stinging sensations during urination are also common. Frequent and urgent urination. The need to urinate more often than usual, even when the bladder is not full. Cloudy or bloody urine. The urine may have an unusual color or contain visible blood. Nausea and vomiting. Some individuals may experience nausea or vomiting, especially in severe cases. Fever, chills, a burning feeling or pain when urinating. Having to urinate often. A strong, lasting urge to urinate. Back, side or groin pain. Nausea and vomiting. Pus or blood in the urine. Urine that smells bad or is cloudy. Belly pain. Dark, cloudy, or bloody pee. Pee that smells bad. Fever and chills. Loss of appetite. Needing to pee a lot. Feeling pain when you pee. Pain in your lower back, side, or groin. Upset stomach, nausea, and vomiting. Drink fluids, especially water. Fluids can help remove bacteria from the body when you urinate. Urinate as soon as you need to. Don't delay urinating when you feel the urge. Empty the bladder after sexual intercourse. Urinating as soon as possible after sex helps clear bacteria from the urethra. This lowers the risk of infection. Wipe carefully. Wipe from front to back after urinating and after a bowel movement. This helps prevent bacteria from spreading to the urethra. Avoid using products in the genital area. Deodorant sprays in the genital area or douches can be irritating. Keeping your genitals clean and treating any constipation. Prevention. Treat UTIs promptly. Seek medical attention for any signs of a bladder infection to prevent it from spreading to the kidneys. Practice good hygiene. Wipe from front to back after using the toilet, especially for women, to prevent bacteria from entering the urethra. Urinate after sex. This can help flush out bacteria from the urethra. Stay hydrated. Drinking plenty of fluids can help prevent bacteria from lingering in the urinary tract. Consider other preventative measures. Talk to a doctor about other steps you can take to reduce your risk of kidney infections, especially if you are prone to them.
Treatment. Antibiotics. Kidney infections are typically treated with antibiotics prescribed by a doctor. Hydration. Staying well hydrated by drinking plenty of fluids is important for flushing out bacteria and aiding recovery. Pain relievers. Over-the-counter pain relievers can help manage pain and fever. Hospitalization. In severe cases, hospitalization may be necessary for intravenous antibiotics and other supportive care.
Kidney infections in females are primarily caused by bacteria, most commonly E. coli, that travel from the lower urinary tract, bladder, up to the kidneys. This ascent typically occurs after bacteria enter the urethra and multiply, potentially leading to a bladder infection that can then spread to the kidney. Ascending infection. The most common pathway is through the urinary tract. Bacteria, often from the bowel, enter the urethra, travel to the bladder, and then ascend through the ureters, tubes connecting the bladder to the kidneys, to infect the kidneys. Bacterial cause. E. coli is the most frequent culprit, but other bacteria can also be responsible. Risk factors. Certain factors can increase the risk of kidney infections, including female anatomy. Women are more susceptible due to the shorter urethra, making it easier for bacteria to reach the bladder and kidneys. Bladder infections. Untreated or recurrent bladder infections can escalate to kidney infections. Urinary tract obstruction. Conditions like kidney stones or structural abnormalities can hinder urine flow, creating an environment where bacteria can thrive. Diabetes. Diabetes can weaken the immune system and increase susceptibility to infections. Weakened immune system. Any condition or medication that compromises the immune system can make individuals more vulnerable to kidney infections. Bloodstream infection. In rare cases, bacteria from other infections in the body can spread to the kidneys through the bloodstream.
Kidney infections in males, also known as pyelonephritis, are primarily caused by bacteria ascending from the lower urinary tract, often originating as a bladder infection. While less common than in females, these infections can occur due to factors like urinary tract obstructions, congenital abnormalities, or weakened immune systems. 1. Ascending infections. Most common route, bacteria, commonly E. coli from the bowel, enter the urethra and travel up to the bladder. Spread to kidneys. If the bladder infection, cystitis, isn't treated or doesn't resolve, the bacteria can then move up the ureters, tubes connecting the bladder and kidneys, to infect one or both kidneys. Urinary outflow obstruction. Anything that prevents complete emptying of the bladder, like kidney stones or an enlarged prostate, can lead to urine stasis and allow bacteria to multiply and travel up to the kidneys.
Vesicoureteral reflux, VUR. A condition where urine flows backward from the bladder to the kidneys, increasing the risk of kidney infections. 2. Other causes. Hematogenous spread. In rare cases, bacteria from another infection site in the body can enter the bloodstream and travel to the kidneys. Post-surgical infections. Kidney or bladder surgery can sometimes lead to kidney infections. Weakened immune system. Individuals with compromised immune systems, due to conditions like diabetes or medications, may be more susceptible to kidney infections, including those spread through the bloodstream. Prevention. Maintaining good hygiene, staying hydrated, and addressing any underlying urinary tract issues can help prevent kidney infections. Why males are less susceptible. Anatomy. The urethra in males is longer than in females, making it more difficult for bacteria to travel up to the bladder and kidneys. Prostate. The prostate gland surrounds the urethra in males and can sometimes cause urinary obstruction, but it also secretes substances that can inhibit bacterial growth. Important considerations. Early treatment. Kidney infections are serious and require prompt medical attention. Antibiotics are the primary treatment. Symptoms. Symptoms can include fever, chills, back pain, nausea, vomiting, and frequent or painful urination. For optimal kidney health, focus on a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, while limiting processed foods, salt, and alcohol. Fruits like berries, grapes, and apples, and vegetables such as cauliflower, onions, and eggplant are excellent choices. Lean meats, fish, and eggs provide protein, and whole grains like brown rice and whole wheat bread offer fiber. Proteins. Lean meats, poultry, fish, egg whites, and plant-based proteins, like beans and lentils, are good choices, but individuals with kidney disease may need to adjust their intake based on their specific needs and dialysis treatment. Whole grains. Brown rice, quinoa, oats, barley, and whole wheat bread offer fiber and nutrients while being lower in sodium than refined grains. Foods to limit or avoid. High-sodium foods, processed foods, fast food, and salty snacks can put a strain on the kidneys. High-potassium foods. Bananas, oranges, and other foods high in potassium may need to be limited for individuals with kidney disease, especially those on dialysis. Excessive protein. While protein is essential, those with kidney disease may need to adjust their intake to avoid overworking the kidneys. Alcohol. Excessive alcohol consumption can negatively impact kidney health. Red grapes. Red grapes are a good source of antioxidants called flavonoids, which may help reduce inflammation and protect against heart disease, diabetes, and other health conditions. 1/2 cup, 75 grams, of red grapes contains sodium, 1.5 milligrams potassium, 144 milligrams phosphorus, 15 milligrams protein, 0.5 grams. Skinless chicken. Trusted source. Breast has less fat than chicken with the skin on. Trusted source. Trusted source. Food Data Central. Highly respected food and nutrition database from the United States Department of Agriculture. Governmental authority. Go to source. 2 or 3 ounces, 85 grams, of cooked, skinless chicken breast contains trusted source. Sodium, 64 milligrams potassium, 220 milligrams phosphorus, 196 milligrams protein, 27 grams. NIDDK advises trusted source people with kidney disease to limit portions of meat and fish to 2 to 3 ounces, as high protein levels can make your kidneys work harder. Bulgur. Bulgur is a whole grain wheat product and a kidney-friendly alternative to other whole grains that are higher in potassium and phosphorus. Bulgur provides B vitamins, magnesium, and iron, as well as plant-based protein and fiber, which is important for digestive health. A half cup, 91 grams, serving of cooked bulgur contains sodium, 5 milligrams potassium, 62 milligrams phosphorus, 36 milligrams protein, 3 grams. Garlic provides a tasty alternative to salt, adding flavor to dishes while also providing nutritional benefits. It's a good source of manganese and vitamin B6. It also contains sulfur compounds with anti-inflammatory properties. 3 cloves, 9 grams, of garlic contain sodium, 1.5 milligrams potassium, 36 milligrams phosphorus, 14 milligrams protein, 0.5 grams. Egg whites. Egg whites provide a high-quality, kidney-friendly source of protein that is low in phosphorus. Egg whites may be a better choice than whole eggs for people on a renal diet, as egg yolks can be high in phosphorus. 2 large, raw egg whites, 66 grams, contain sodium, 110 milligrams potassium, 108 milligrams phosphorus, 10 milligrams protein, 7 grams. Red grapes. Red grapes are a good source of antioxidants called flavonoids, which may help reduce inflammation and protect against heart disease, diabetes, and other health conditions. 1/2 cup, 75 grams, of red grapes contains sodium, 1.5 milligrams potassium, 144 milligrams phosphorus, 15 milligrams protein, 0.5 grams. Cauliflower provides many nutrients, including vitamin K, folate, and fiber. It also contains antioxidants and anti-inflammatory compounds. Try mashed cauliflower in place of potato for a low-potassium side dish. 1/2 cup or about 62 grams, of boiled cauliflower without salt contains sodium, 9.3 milligrams, mg, potassium, 88 milligrams phosphorus, 20 milligrams protein, 1 gram. Sea bass is a fish option that provides high-quality protein. It also contains healthy fats called omega-3s. Omega-3s may help trusted source prevent a range of diseases and boost the health of those living with long-term conditions. 3 ounces, 85 grams, of cooked sea bass contains trusted source, sodium, 74 milligrams potassium, 279 milligrams phosphorus, 211 milligrams protein, 20 grams. Blueberries are rich in nutrients and antioxidants known as anthocyanins, which may protect trusted source against heart disease, diabetes, and other diseases. They're also low in sodium, phosphorus, and potassium. 1 cup, 148 g, of fresh blueberries contains trusted source, sodium, 1.5 milligrams potassium, 114 milligrams phosphorus, 18 milligrams protein, 1 gram. Cabbage belongs to the cruciferous vegetable family and provides vitamins, minerals, and antioxidant compounds. The authors of a 2021 study trusted source note that cabbage contains bioactive compounds that might help manage blood sugar and reduce the risk of kidney and liver damage, though research in humans is needed. White, green, and red cabbage may help manage blood sugar, reduce the risk of kidney and liver damage, prevent oxidative stress and obesity. Onions provide vitamin C, manganese, and B vitamins, including folate. They also contain trusted source prebiotic fibers that help keep your digestive system healthy by feeding beneficial gut bacteria. 1 small onion, 70 grams, contains trusted source, sodium, 3 milligrams potassium, 102 milligrams phosphorus, 20 milligrams protein, 0.8 grams. Macadamia nuts are a delicious option for people with kidney problems. They're lower in potassium and phosphorus than peanuts or almonds. They also provide healthy fats, folate, vitamin B, and the following minerals: calcium, magnesium, copper, iron, manganese. Pineapple can be a sweet treat for people with kidney conditions. It is lower in phosphorus, potassium, and sodium than oranges, bananas, or kiwis. Pineapple is also a good source of fiber and vitamin C, and it contains bromelain, an enzyme that may help reduce trusted source inflammation. 1 cup, 165 grams, of pineapple chunks contains trusted source, sodium, 2 mg potassium, 180 mg phosphorus, 13 mg protein, 1 gram. Arugula is a flavorful and nutrient-dense green that is low in potassium, making it a good choice for kidney-friendly salads and side dishes. Arugula provides vitamin K, manganese, and calcium, all of which are important for bone health. 1 cup, 20 grams, of raw arugula contains trusted source, sodium, 5 mg potassium, 74 mg phosphorus, 10 mg protein, 0.5 grams. Bell peppers are high in vitamins A and C and other antioxidants but low in potassium. These nutrients are important for immune function, which is closely linked trusted source with kidney disease. 1 medium red pepper, 119 grams, contains trusted source, sodium, less than 2.5 mg potassium, 213 mg phosphorus, 27 mg protein, 1 gram. Olive oil is a healthy source of vitamin E and mostly unsaturated fat. It's also phosphorus-free, making it a suitable option for people with kidney disease. Most of the fat in olive oil is oleic acid, which has trusted source anti-inflammatory properties. What's more, monounsaturated fats are more stable at high temperatures. Trusted source, making olive oil a healthy choice for cooking. 1 tablespoon, 14 grams, of olive oil contains trusted source, sodium, 0.3 mg potassium, 0.1 mg phosphorus, 0 mg protein, 0 grams.